My name is Dr. Patrick Ezie. I'm a specialist minimal access surgeon with background in surgery of different types. But today I'll be talking about recent developments in technology and primarily as regards to surgery. We have come a long way as a race and as human beings. We've been able to develop a lot of ways of treating illnesses. Surgery is not a new area of development in the care of human beings as such, but in recent times we have achieved so much, and we have what we call the um, classic way of doing surgeries, which we all know about. So for appendectomies, you have your open surgeries. Cesarean sections, you have your open surgeries, and so most surgeries for the longest time have been done in an open way. It will surprise you to know that the contributions to surgery have come from various fields. For instance, a lot of people don't know that the term cesarean section was actually coined because Julius Caesar, who was emperor of Rome, during his battles, will stumble upon pregnant women who were dying in battle, and he would just cut them with his knife and extract the babies. So in those days, the mothers will definitely die from such an injury, but the babies go on to live, and because he started doing that, the term cesarean was given, that was his son name, Caesar, was given to the procedure. So what we now did as doctors is to now perfect what he started by ensuring that the mother lives after you cut her open, and that's the beginning of surgery. So these days, there's always a lot of contributions to the development of surgery. So for the longest time, we've had open surgeries as a major way of solving a lot of surgical problems. And currently, we have evolved beyond that. We now have a new area of surgery we call minimal access surgery. When I say new area, I'm not talking about 19th century. This actually already started in the 18th century. Mhm. So in minimal access surgery, what the surgeon does is that we're able to operate on patients without opening them up. And that gives the patients so much advantage. And advantages include minimal stay in the hospital. They can go that day, even for surgeries like an appendectomy. You do the surgery and then they're able to go that day. There's minimal scarring. In fact, most times you can't even find our incision on the abdomen once we're done. And today, minimal access surgery is being done for a lot of gynecological and laparoscopic laparoscopical surgical interventions. So you can do your cholecystectomy, which is removal of the gallbladder, just by making a small incision under the abdomen, and then inserting your cameras, and before you know it, you're done. The patient can still go home that day or the next day. So there's reduced hospital stay, and patients tend to recover faster. Adhesions are less, and also patients are able to move on to their daily lives. The loss of manpower that minimal access surgery brings to the table is phenomenal. Also, minimal access surgery, as one of the pioneer areas of development of technology in the field of surgery, didn't I won't credit it to those who started in the 18th century, but even before then, 400 years before Christ, Hippocrates, who was one of the founders of medicine, also try to use some form of tool to see what the inside of a human being looks like. And then by the 18th century, people were now using sunlight and shining it through a tube to look into the abdomen to see what was going on. Now we have all kinds of equipment that we use to do this wonderful surgeries, depending on where it is. We're even able to remove fibroids endoscopically, and the results are excellent as well. So with that development came a lot of contributions. So of course you have the surgeon who is able to perform these feats, but you also have a well-organized team of biomedical scientists of preoperative nurses, of nursing assistants, and all that, because it's an area that is heavily dependent on equipment. So you need to have your cameras working properly because you're working inside the abdomen and you don't have direct access. The surgeon also has to have extensive training to be able to manipulate the intestines and the gut and the ovaries of individuals without damaging them. And then we also have to have sufficient room to do all this, do our suturing inside the abdomen and coming out without even damaging structures. So there's a lot that goes in. It's actually an area that requires a lot of contribution from other sectors. So that's where we are today with minimal access surgery. We're able to do so. In fact, there are very few surgeries that cannot be done through minimal access. Um, Currently, the current developments is that we have taken minimal access to the next level, which is what we call robotic surgery. So in robotic surgery, we're able to, working with scientists, develop a machine we call the Da Vinci robotic machine. So what the machine does is that it's able by itself to perform those surgeries without human beings. And then it reduces the risk of tremors. As you get old as a surgeon, you may start having tremors and all that. So the operator, usually a surgeon or anybody who is sufficiently trained, works in a cockpit, and then the machine has like 6 arms and is able to do all that work on the individual and still have the same results that you will have from a master surgeon performing the same skill. And it also fascinate you to know that this robotic surgery can be done remotely. So what do I mean by remotely? There's a team was able to do the surgery in the US while the surgeon himself was in the UK, a transatlantic surgery. So that shows you how far the technology is with regards to modern day surgery. So you don't need your surgeon to even be in the same city with you. He can be in the UK and in the US, and he will be controlling a robot that is in the US to perform that surgery on you. So that is one of the advantages. But of course, a lot of surgeons also fear that when you have something this advanced, before you know it, surgeons become obsolete. The robot can do it, and someone can be in his house doing it. He doesn't need to come to work. But however, Nigeria is still very, very far away from such advancement. Even with minimal access surgery, there are very few specialists trained to perform minimal access surgery, and there are very few people who can afford minimal access surgery. So all these things, for instance, if you were going to do an appendectomy, it will cost you 3 or 4 or 5 times the amount, to do its minimal access way. So we still have a lot of catching up to do. And then, of course, there is a need for government to also encourage training and then also look at the curriculum of doctors to retrain them to begin to use this advanced technology on time. Because at the end of the day, that's where the world is. In fact, 90% of most surgeries done overseas are done minimal access. They're even beginning to forget how to do open surgeries. So these are the current developments in the realm of surgery. Also, minimal access surgery is also being used for all kinds of brain surgeries these days, even thyroid surgeries can afford. You can do a lot of surgeries. The only thing I think we have not perfected is to deliver a baby through minimal access. And there is some development. Someone was able to perfect some technology to put the baby in a bag and just bring him out, and all that. So the development is really at cutting edge, and we have a lot more minimal access surgeons these days than we used to have in the past. So for other fields of medicine, there is a lot of advancement also technologically, apart from the surgical aspect. Diagnostics has come a long way. So even in minimal access surgery, I didn't even tell you, before we had minimal access surgery, we had diagnostics. So diagnostic means that, okay, you have an abdominal pain, you don't know what it is, you've done the scans have shown you that there might be something, but you can't really see. But With laparoscopy, we are able to put you on the table, put our cameras inside, and move around, and then you can see inside the body in real time what's going on. Is the appendix inflamed? Is it an acute abdomen? Is it an intestinal obstruction? You can see it very clearly, on the screen. And then when you're done with the endoscopic procedure or laparoscopic procedures, a CD of it is given to you. So if you doubt, you can play it and see that this was inside my. This is what the surgeons were able to find out. So that in itself pushes the realm of diagnosis a very long way ahead. There's also for infertility, there's a lot of impact of this in infertility. A lot of women may have frozen pelvis. There's no way a modern day scan can tell if a woman has frozen pelvis. You have to see it. So with laparoscopic interventions, you can see the uterus and all the agnesia come together. You see, this is a frozen pelvis. You know, and then it enables you to clinch diagnosis faster and more accurately, and you're able to seek for solutions that are specific for the problems uh, that patients have. You know, so then also in the realm of diagnostics, of course, we have MRIs and CT scan, PET scans that are able to do so much in terms of investigation, staging of cancers, identifying problems where they are not. Sometimes where you have very serious limitations, I was opportune to work in a rural area where someone had an abdominal mass. The scan was not helpful. So I had to do a laparotomy for her. What's a laparotomy? A laparotomy means you open up and you see before, and then when we saw like, oh, is this what's happening? We can't operate. We have to come back. But if you have the where the laparoscopic equipment are, you would have seen that through her buttonhole. That's okay. There's no point operating this woman. We can come back at a later date, and it's evolving, and there's a lot that is being developed technologically to assist surgeons, physicians to do a lot better at the work that they do. These days, medicine is the practice of medicine and surgery is based on laboratory results. Hardly will a surgeon and doctor touch you without telling you to go and do a test or one investigation or the other. So it's result oriented. So because of that, technology has to also evolve in those areas as well, because that evolution also feeds back to the work that surgeons and doctors do, to enable us ensure that we have better outcomes for our patients. So I want to end by talking about artificial intelligence and cloud computing, which is one of the areas that's gaining a lot of ground. So, for instance, the Da Vinci robotic machine I was talking about is artificial intelligence generated. So, what it does is that if I'm a master surgeon, right, maybe I'm the best at what I do, the machine, the AI, is able to watch me perform surgery and copy exactly my hand movement and all that and replicate it. Do you understand? Replicate it and improve on it in such a way that you now have a machine that has copied my skill and evolved it to a next level. So like for instance, if I'm able to do maybe a cesarean section in 45 minutes, the Da Vinci copies my skill, he can bring it down to 20 minutes or even 15 minutes. So they're able to copy and improve on hand movements, because everything we do, even though it looks like it's a science, there is also mathematics to it. The amount of energy, the amount of force, and all that. So you now have robots that can perfectly replicate exactly your hand movements with the same degree and intention that the surgeon would have done. It is quite scary, but that's where we are. So I remember in Japan, we had an expert surgeon that could perform a particular kind of cardiac surgery. He used two hands to do it. And the the machine was brought for him to teach the machine, the Da Vinci machine, how to perform that particular type of surgery. And it took a long time, but when he finally agreed, he said he will only teach the machine how to perfect the skill of only one of his hands. Do you understand? So that the Da Vinci machine will always need is second hand or will have that lag for some time. So it shows you that interface between AI and modern technology. So we created AI, but AI in the future will be able to do things far better than we are. So you can imagine a master surgeon, a master cardiac surgeon, being worried that if I take all these skills now, this machine will copy it and render me obsolete. you know. So there's that fear from highly skilled surgeons that one day machines will retire us. But if it is for the greater good, I think it is not. It's not. All we want is that human beings live longer. Our skills are able to translate, in some sense, to better outcomes. So it's like saying that because you were the greatest trekker of all time in the past, then they shouldn't invent cars, or shouldn't invent aeroplanes. You want everybody to continue to trek and all that. So human evolution is at a point where we're going to experience a quantum leap because of artificial intelligence, and it's not just with regards to um, surgery. Also in the field of medicine, Elon Musk is able to do implants in the brain now that enable people to even have control over their computers without touching them and all that. All those scientific advancements, there's cyber genetics, human beings, as a way of living forever. If I take you now and I replace you with metal parts, which we're already doing, if you have a fractured hip, we put the metal plates for you. We do knee replacements, we do hip replacements. So in the future, it's possible that you may be able to replace a human being so much so that the parts of the human being that are supposed to die in the ground are no more. And then you have a computer system that helps the brain to live forever. So even those things like that are no more so far into the future as such. So there's a lot of that's the quantum leap I'm talking about with artificial intelligence, where you now have that possibility. And then with things like Mars exploration on one hand, human beings, your lifespan is 70 years. The trip to Mars is 2 years. It's almost 20 years. So how are you going to pilot a plane to Mars if you're not your lifespan is already one third of the way? And when you get there, can you really survive on a planet that is hostile? So you see that's where all the engineering and the medicine and the sciences that has been developed now starts pushing the frontier. The only human beings you can have who will be able to do that are cybernetically enhanced human beings. So anyway, that's so far into the future. Then let me come back to the present, where you have a lot of illnesses like sickle cell. We're able to do gene modifications in utero. So, for instance, if you have, you're able to do that in Japan with, they were able to delete chromosomes that enable people to get HIV. So you now have children who are born that cannot have HIV because the genetic makeup that enables them to get it was deleted in utero. You know, so those are kind of advancements that we're having now. And it's just that because of the ethics involved, there's a lot of restriction. If not, people are beginning to choose the color of the baby's eyes. These days, you can select sex. It starts from there. You can choose hair color, eye color, choose all those things, and then they arrange it for you and genetically give you what you want. So in the future, a woman will just walk into a clinic and this is a profile of what I want. And she's the baby gets all those genetic enhancements. So those are future trends. As far back as last week, um, there's a development where we have um, men able to be able to nurture a baby outside the woman's entire system. Yeah. So you can have a couple can come and have a child, and she will never be pregnant for 1 day. They will incubate the child, and the child gets to the 9 months, released for them to take care of and all that. So those are current trends. I'm not even talking of future trends. I'm switching between, and as I said, there's a quantum leap because if you look at it, you can see where the future can be and where we are. And AI speeds a lot of these things up. you know, um, so there is a worry at the end of the day, we may have AI dominating the human space. And but I think human beings have a long way to go. It's been said that our brain capacities we only use most of us only use about 4% throughout your lifetime. So we have another 96% that we have not unlocked. So maybe somehow if we unlocked all those other potentials, you might see that there's a lot more. Because with the AI, they are running on full capacity. Once you have an AI system, it gets so intelligent very fast that you begin to wonder, what, I'll give you an example. The other day I took my phone and I was chatting with Meta, and I asked Meta, who is Patrick Eze? And then he wasn't able to answer me. Then he just said he'll be a doctor or someone. Didn't say specific. The next day I asked the AI, who is Patrick Eze? He now brought out my entire profile, everything about me, within 24 hours. So it means that after I asked that question and I was not satisfied, the AI was still thinking, why did this guy ask me this question? What do I need to do to better satisfy this, to give the right answers to this question? So those are some of the trends. The last thing I was going to talk about is annihilation of disease. So with AI and cloud computing, you're able to do more because disease systems are just an assortment of proteins. So the reason why somebody is tall and another is short is just genes and proteins. Why people have sickle cell disease and others don't, it's protein. One protein is missing here, and then the person develops a sickness, an illness. Mhm. So in the future, AI will be able to help us solve that problem because we now understand that it's just an assortment. Just like what we do for animals now, you have disease-resistant species. We're even doing that with animals. So with time, you now have human beings that are resistant to malaria. So if the mosquito likes, it can bite from now till tomorrow. So those are the applications. You know, and all that. But of course, with all this, there needs to be a very strong ethical guidance. Human beings have always lived with an ethical code, and we always try to make sure that all that we're doing doesn't turn us into the robots that we created, and that there's still some humanity left. It's the same reason why in 1994 we were able to clone a sheep, but nothing has been done in cloning since that time. Nothing public has been done in cloning since that time. It's not that the technology is not there. We do have the technology. We can clone a sheep, we can clone a human being. But because of the ethical ramifications, so what can happen is that maybe today I don't feel like coming to work. I send one of my clones to come, and I now have a clone for everything, and then there's one clone somewhere. So it will make the world insufferable. And that's why with every quantum leap we make, sometimes we don't want to lose our humanity because we are advancing. So that is where ethics comes into the issues. So sometimes ethics has a way of slowing down scientific development and the progress of new technology. But it's a necessary element in what we're doing. And one of the reasons why people fear AI so much is that sometimes if you have an AI that is uncontrolled, it won't have those ethical bounds, or there's nothing holding it down ethically, and it becomes a challenge or a problem, or an existential threat. Let me use that word. So that's why you now have things like AI singularity and all that, and AI becoming all self-aware, all self-conscious, can manipulate um, things beyond what its own originator wanted it to do. So, in conclusion, um, medicine and surgery has been around for a long time, and advancements always help us to do more, but both surgically and medically. Um, but these days, I feel our country, Nigeria, is not advancing as fast as we're supposed to, and there has to be more investment. That's why you have a lot of collaborations, people trying to do more with the less that is available. And because at some point, somebody will require some of these things that look like, oh, it's only found overseas. here and you can't fly the person out. But you have people that have the skills, but they do not have the equipment. So that continues to be the challenge that Nigerian physicians have, and that's why most of us just say, you know what, I'm traveling out, and they forget about everything. Yeah. So, in conclusion, I'd like to say that recent technologies have pushed the frontier of surgery and medicine to the level where we may almost annihilate the things that plague us today. But we have to be cautious and also have an ethical construct going forward. Thank you.